Have you ever heard of kidneys not forming correctly? It sounds strange, but it can happen. This is called renal dysplasia. Our kidneys are like filters for our bodies. They clean our blood and make pee. With renal dysplasia, the kidneys don't grow the way they should. Renal dysplasia happens when a baby is still in the tummy. Sometimes cysts form in the kidneys. Cysts are like little sacs of fluid. These cysts can make the kidneys much bigger than normal. Sadly, these kidneys might not work very well. There are different types of renal dysplasia. Sometimes only one kidney is affected. Other times, both kidneys have problems. If both kidneys are affected, it can be serious. This is because the body has no way to filter the blood properly. Renal dysplasia can be mild or severe. Some kids might not even know they have it until they are older. Others might have problems from birth. Early diagnosis is very important. Doctors can often spot renal dysplasia before a baby is born. They use a special test called an ultrasound. An ultrasound is like taking a picture of the baby inside the tummy using sound waves. It helps doctors see if the kidneys look unusual. If doctors think a baby might have renal dysplasia, they will do more tests after birth. They might use a different type of ultrasound on the baby's back. This gives a clearer picture of the kidneys. They will also take blood and pee samples to check how well the kidneys are working. Sometimes doctors need to look even closer at the kidneys. They might use a special scan called a MAG-3 scan. This scan uses a tiny amount of radioactive material to see how the kidneys are filtering. It helps figure out if one or both kidneys are affected. Not all children with renal dysplasia have symptoms right away. Some kids might seem perfectly healthy, even if their kidneys aren't working perfectly. However, there are some signs that parents can watch for. If your child has renal dysplasia, they might get tired easily. They might not feel like eating much, and their skin might look pale. Sometimes their face or legs might look swollen. This is caused by extra fluid in the body. Other signs include needing to pee more often or having accidents, especially at night. If you notice any of these signs, it's important to talk to your doctor. Don't panic. These symptoms can be caused by other things too. But it's always best to be safe and get checked out. Section 4. Understanding the impact. Renal dysplasia is more common than you might think. It affects about 1 in 1,000 babies. That's like one baby in a small town. Boys and girls are equally likely to have it. The good news is that many children with renal dysplasia live long and healthy lives. If only one kidney is affected, the other kidney can often do the job of both. However, some children with renal dysplasia might have other health problems too. These can include high blood pressure or problems with their bones. For children with severe renal dysplasia, life can be more challenging. They might need regular hospital visits and special medicines. In some cases, they might even need a kidney transplant. Section 5. Living with renal dysplasia. Early detection is key when it comes to renal dysplasia. The sooner it's diagnosed, the sooner treatment can begin. This can help prevent serious complications and protect your child's kidneys. If your child is diagnosed with renal dysplasia, it's important to find a good doctor who specializes in kidney problems. They can help you understand your child's condition and create a treatment plan. This plan might include regular checkups, medications, or dietary changes. Remember, you are not alone. There are many resources available to help families living with renal dysplasia. With the right care and support, your child can lead a full and happy life.